So today we're doing reactive muscles. So we're going to look and see if she does have a reactive pattern. And we're going to see if, we're going to do a quick test. She already had the balancing done, pre-test, full balancing. We found over energies, under energies, and she got balanced. So let's just see here, meet my pressure. Okay. This is a quick test to see if she has under energies. Can you all see?
Mm-hmm.
Yeah. Okay, meet my pressure. Okay. Okay, she does have a pattern somewhere in her body. So now I'm going to look and see what she had before. She had over energies in the kidney meridian, liver meridian, circulation meridian. She complained of upper back neck tension or stiffness, I think, and a little bit of a right knee thing as well, pain or something like that. So let's, since we're doing level 3 here, and we did with the kidney, it was upper trapezius. That's a good one to try out. And then the rhomboid ones for level 3 muscles. With the liver meridian, and then circulation we can look at the glute later. But let's try out the upper trapezius muscle, because she's on the phone all day like this, typing away, potentially. I know her, that's why. Okay, and so let's pick out
Upper tract.
yeah, the upper traps. Let's try out on the right side. We're going to use circuit retaining mode with this. When I test this muscle out here, what you're going to do, you're going to open up about this far. Okay? Let's try it out so that you know what we're doing. So bring your shoulder up to your ear and your ear to the side. This is the upper trapezius muscle test. Okay? So when I say meet my pressure, you're going to open up your legs that same distance that we practice, okay? And hold. Okay. Okay, that's good. And we don't have to practice. She's going to stay. Okay, she's going to stay there because she did it so good. So she's in circuit retaining mode. Her body is saying upper trapezius, upper trapezius, upper trapezius. Say that 10 times on the right side. So now let's see what muscles may shut off or go under energy in relation to that right trapezius. So let's try out the rhomboids, since it was an over energy, but let's see in relation to this muscle. So I want you to squeeze like this, okay, and then meet my pressure. Okay, that's pretty good on this side. And then let's try this side here. Okay, that locks. So that upper trapezius is not doing anything to that, it's not affecting the rhomboid muscle. So let's try out the other side of the trapezius, upper trapezius. So relax your shoulders. Okay. So bring your shoulder up like that, okay, and then hold here. Meet my pressure. Okay, that doesn't affect her. Okay, so I'm not getting any pattern yet. I can go and test the front part of her muscles, because front and back is another relationship that you can think about when you're thinking of reactive patterns. So I'm going to be testing in this direction. That's the pectoralis major sternalis, hold. Okay. And then I'm going to test in this direction. That's the pectoralis major clavicular. Okay, and hold here. Okay, so that unlocks. So that unlocks. Let's try the other side. And hold like that, and meet my pressure. Okay, and then hold like this, and then meet my pressure. Okay, that locks. So now we have, in relation to that upper trapezius on the right side, which is in the back, one of the front muscles are unlocking, or they're reactive to her. So now I'm going to test the anterior deltoid. Let's see what happens there. Hold. Okay, this unlocks. Let's see here. Hold. That locks. Okay, so now we have anterior deltoid, and we have the pectoralis major sternalis related to the stomach meridian. Let's try other deltoids on the side that's related to lung meridian. And then hold here. Okay, that's pretty good. And then this one here, let's see. It looks like she's sticking to one side. Hold here. Okay, good. Okay, so and so we can go on. We can test all our muscles in relationship to that. Let's try the levator scapula, because that's a good one. Okay, so the teapot. You don't have to do that on that side. Okay, and you turn your head there. Okay, and then hold here, meet my pressure, okay? Okay, so that unlocks. See, all these muscles are, and go the other way, are attaching to the shoulder joint at some point, and then hold here, meet my pressure. Okay, that locks. Okay, so now I know that the upper trapezius muscle affects about 3 muscles. Now, can you close your legs together? Let's see, just to show you that we close the circuit. Let's see those muscles that weren't locking, that were unlocking,
If they're locked.
in relationship to the upper trapezius on the right side. Okay, let's see if they lock. Hold like this. See, on their own, hold like this. Let's see what happens. They're actually locking. So I did test this one here. Levator scapula, and hold here. Okay, so you see how they're locking? But when I put it in relationship to the upper trapezius, they were unlocking. So they're reactive. And the upper trapezius is the one that's the reactor. It's the bully in the playground. So now what do? I have to use a sedation technique to shut off the upper trapezius, or bring the tone down. So I'm going to use muscle spindle technique, push to mush. So the upper trapezius, you have to know where it is, and then you can go on the stomach, but I can reach it here. Are you okay? It's that diamond-shaped muscle in the back.
You're just rubbing it?
Yeah, I'm pushing to mush.
Oh.
Muscle spindle in the muscle belly, and we're bringing the fibers together.
Okay.
So then it's sending a signal to the brain, and then it's gonna potentially unlock it, but now we're gonna test it to see if it unlocks. So bring your shoulder up and your ear to the side. Okay, just so I can get in. Now come together. Okay. At the same time, I want you to open your legs 18 inches apart like before. Okay. So hold here, hold. Okay. So she unlocks here. Now she's staying like this. We sedated the upper trapezius muscle. Let's go back to those muscles we've tested before, which were the pectoralis major clavicular, which is related to stomach meridian. So I meet my pressure. Okay. So I'm doing a hard lock. So I'm just challenging her muscle to really wake up. So I usually do it 3 times. But this looks like it's powering up pretty good already. So you can see feel the fullness. If it's a little mushy, make them work at it, it'll get stronger by the 3rd one. And then the other one is anterior deltoid, right? And hold here. Okay, this feels pretty good. You can do it still 3 times if you want. And then this is the teapot, levator scapula, and hold here. Okay, this one wants to work a little bit. Hold. Okay, and again. There we are. And then come back. So now we powered up all those muscles. Now we're going to close the circuit. Okay? And we have to re-challenge. We have to retest to see if it worked. So we're doing the first test again. The middle test was sedating. And the 3rd test is the same as the first. So we're going to bring her shoulder up to her ear. And her upper trapezius recalibrated itself already, as we saw yesterday in our examples. You come together, at the same time, separate your legs. Hold. Oh, sorry. Okay. But give me a resistance here. Okay, hold. There we go. Okay. So she locked here with her upper trapezius, right? It recalibrated it, did that. But let's see. Right now we have it in circuit retaining mode, the upper trapezius on the right side. Let's see if it's a reactor or the pectoralis major clavicular muscle is reacting. It's a reactive, sorry. Hold, okay. No, that's okay. Hold like this, anterior deltoid. And then let's do your scapula, and hold here. Okay. Now you can close the circuit. So do you see that her muscle actually all the muscles started to work a bit better in relationship to the upper trapezius muscle. Now let's see if she has any more reactive patterns, because she had other over energies, but maybe she doesn't. Hold like this. Okay. So hold again. Hold. Okay. So it's not bad. So we chose the right one right off the bat, but it brought us to the area of her neck because she kind of complained about that. So it gives you an idea, and you look at your chart of over energies. Okay, so that was really good. You did a good job.
Thank you.